Hi everybody, just wanted to stop in and kind of tell everybody about what's been going on with me. So, like I said in my last post, I am doing much better now. Pain is not gone, but significantly better. So what kind of happened with me is I was doing a lot of workouts. I was stretching, I was strengthening during the hardcore quarantine. I was off of work for 3 months and, I was doing really well. I felt like I was doing really well. I was really strong. I was really flexible. I felt ready to go back to work. I was a little hesitant about going back to work because it was kind of the bending motion that would kind of send my back into spasm. And that's kind of what I do all day. I'm always leaning over tables and working on people. So I just figured it was something I had to work through and part of the rehab process. And I think some of it did kind of kick up a little bit after I went back to work, but it didn't really get bad until about 3 weeks in. And I've been seeing tons of people to try to help me because at first I was trying to manage it with exercise, but it got to the point where I knew that exercise was no longer going to help. And your body can get to that point where the joints are locked, or if the muscles are just too far in spasm, if you try to stretch them, honestly, it just pisses them off more. They just want to tighten up and they're inflamed and they're irritable and they're angry and they just want to stay tight and contracted. And you go to stretch it and it just responds by tightening up more. So if you're ever in that area where you have pain and you're trying to stretch and the stretching doesn't feel good, that's a sign. That's telling you that something is not right. So then you need to go see a professional. And what professional do you need to see? That can be a tricky question. So it could be a physical therapist, it could be a chiropractor, it could be an acupuncturist, it could be craniosacral therapy, massage. I mean, there's so many things, and you just need to find what works for you. And sometimes you need to search within each of those professions to find the person that does what works for you. There are some physical therapy clinics that are very exercise based. You might see the therapist a couple times, you might do a couple mobilizations, check your knee, check your hips. Some clinics are just so busy, they just don't have a lot of time to spend with the patient. And unfortunately, I know that if I were to ever go to one of those clinics for this, it would have never helped me. It would have made me worse. So I specifically saw somebody for, the hands-on manual therapy, does osteopathic type manipulation and works with the fascia and the connective tissue and all of that. With that being said, even before that, I saw my doctor that I work with gave me a cortisone injection in my hip flexor, and man, that actually made it easier for the manual therapist to actually mobilize me because I was so swollen and so inflamed. I don't know if there's much he could have done if I didn't have that injection. And I'm not a big injection person. I really try to go towards the homeopathic, holistic type, natural type of treatment first. But it was so painful, I needed something. So I just wanted to educate some people out there about what was happening with me, and then kind of show you my very first exercise that I did to start calming things down. So this is my little mini spine here. So this is the spine, this is the pelvis, and these are the hips, okay? So I think a number of things were happening with me, but the biggest thing was I could tell that I could not stretch. I could tell it was my hip flexor. My hip flexor was just, I had pain, I had impingement in my hip, so I could not flex my leg, and I could not flex my spine without getting a pinchy moment in that hip. So that's called femoroacetabular impingement. It's where the hip flexor comes down there and it just gets pinched in that joint anytime that it gets compressed. And there goes the hip. That's one broken hip. So anyways, if you don't get this joint moving, things just get really inflamed. And so that was one thing that was happening. The hip flexor, I think, got very, very angry. And why? Well, I was flexed. I was hunched over for 3 to 4 weeks. And so, I mean, afterwards I was able to stand up straight because I'd done all my stretches. But at some point that hip flexor got really inflamed and angry. Maybe I was overstretching, maybe I stretched too hard, but it felt really good at the time. And so sometimes you just don't know. But I think something caused my joint to get really jammed, my SI joint, okay? And I'm gonna leave this hip off, but basically what happened with me is, so this pelvis here, when you walk, so you've got the ilium here, and then you've got the sacrum on the back, and that is the SI joint, okay? When you walk, those ilium should move equally and symmetrically back and forth. It's not a big movement, but it's a really important movement. And sometimes they can get really jammed, okay? And they don't really get jammed in a neutral position. They can be rotated forward or back. They can have in flares, out flares. There can be up or down slips. I am prone to up slips, and I'm definitely typically rotated. So when I went to see a physical therapist at first, I just thought it was it was a rotation, maybe an up slip. Usually when I have something like this, I can go get worked on a couple times and I'm fine. But I kept getting worked on it. It just wasn't getting better. And it still kind of felt like a typical rotation or an up slip. But at one point, the hip actually, like I kept saying, I just feel like I need somebody to distract my hip. Like I actually started having people doing hip mobs because I just felt like my femur was just so far jammed into that pelvis. It just so much compression and so much pain. It was awful. And so basically what happened was I had the injection. It decreased all this inflammation that was in here. I didn't realize how inflamed I was in there. It was just so swollen. So we calmed that down, and then I went and I saw a manual therapist, and I actually had what's called a down slip. So this ilium kind of slid down on my sacrum, and those are really rare. And how I got it, I'm not actually sure. It can be adaptive, but it's usually like, you know, you're clipped into your bike and you fly over the handlebars, or you know, you're on a horse and your foot gets stuck and you get kicked off. It's usually like a downward yanking motion. So how I got that, I don't know, but once I got that down slip back into position, man, with the cortisone injection and that down slip being put back into motion, or back in the right position, I mean, trust me, I've still had quite a bit of pain because that hip flexor is still just angry. Game changer. Like I could actually start moving a little bit better and slightly doing some exercises and just calming it down. And I've just progressively gotten better from there. I also, you know, around the same time I had a 2-man craniosacral session, which was amazing. And for those of you who don't know what craniosacral therapy is, it's a light touch therapy that kind of just, it helps your body heal itself, but it really does bring out a lot of emotions and feelings that can kind of have been bottled up inside. And so a lot of people don't realize is that, you know, your tissues can hold emotions. And I mean, just kind of how people say, I really hold my stress up here on my shoulders, you know, like I'm always really tense. Your body can hold a lot everywhere. And so this procedure was a very emotional procedure. It was a very emotional decision. Should I have it? Should I not have it? There's a lot of fear. There was a lot of, you know, after the fact, I think there's a lot of anger because my abdomen was cut into. And so realistically, like emotionally, I think my hip was just pissed. It was really angry. And it was just holding that there, you know? And so craniosacral therapy can really help work out those things. So can acupuncture, so can physical therapy. I mean, any type of body work when you're releasing these tissues can release emotions. So that was a lot of what was going on with me, I think. I think there was a lot of emotional things being held. I had the pelvic down slip, and then basically that hip flexor is referring into my hip and into my back. And every muscle has a referred pain pattern, okay? So kind of like your heart, when you're having a heart attack, it goes down your arm. Every muscle has some sort of referred pain pattern. And so I think the psoas was referring into my back and down into my hip. It still is, but it's significantly better. So that was a pretty long video explaining that, but I just want to educate people about what has been going on with me and inform anyone that if this ever happens to you, that there's something that can be done. Yes, I think you need to find professionals to help you. But once I got that downslip addressed, I wanted to go over with you a little exercise that I've been doing to try to calm down that hip flexor. Because if I try to stretch that hip flexor, guess what? It gets angry again, okay? So what we want to do is we want to inhibit it. And how we do that is it's called reciprocal inhibition. So when you engage your hamstrings, it turns off the hip flexor because it's an antagonist, okay? So I'm gonna lay down here and I'm just gonna show you. So we want to inhibit the hip flexor at every single attachment. So the hip flexor attaches all the way up to L1, and then at each segment it has an attachment. And then, I mean, it actually has attachments to everything through fascial attachments and ligaments all the way up the spine. But you just want to start here, hook line position. And you can't really see what I'm doing, but what I'm doing is I'm just engaging my hamstrings, like I'm pulling my heels back into my butt. So if I did the motion, it would be like a heel slide, okay? So I'm just laying here with my back flat, and I'm just gonna engage those hamstrings for like 6 seconds. And then I'm gonna relax. And then I'm gonna walk out. So as I walk out, I'm just kind of going to the next level a little bit, okay? And then I'm gonna engage and hold for 6 seconds. And then relax. And then go a little bit further and engage and relax, okay? 6 second holds. And I kind of go out a little, just each time you go a little bit further, you're just getting a little bit a different angle of the hip flexor. And then eventually I want to lay down, and what I want to accomplish is that, like, because my hip flexors are so tight, when I lay down, my back arches quite a bit because these hip flexors are so tight. So I want to try to inhibit them so that my back can lay flat. And then what else I've been doing is I just kind of get in there and I just massage just a little bit. I'll kind of show you from here. I'll get in right through here, just lateral to the belly button, and I can feel how firm it is. And I can kind of just massage it in through there a little bit. And then I can go deeper, and then I can go inferior. And then I'll actually, when I'm hook lying, it's hard to do it sitting up, but when I'm hook lying, I actually try to get on the inside of that pelvis a little bit, because the iliacus, so we have the psoas that attaches from each of these vertebrae, and it goes down through the pelvis. But then there's another attachment. The iliacus actually lies on the inside of this pelvis here, and then it attaches into that psoas, and it comes down. That psoas attaches to the hip right here, okay, on this little tubercle on the inside. So I try to kind of just get my fingers in and press into this iliacus a little bit, and then just massage all through, down through here, and all the tissues through here. And that has really been helping me, and it's a light massage. I'm not digging, because if I really dig and push into that hip flexor really hard, once again, what is that? I don't like that, that hurts. I'm gonna tighten up. Okay, so it's just really soft massaging and just kind of trying to break up all of that fascia and scar tissue through there. So I know this was a long video today, so sorry about that, but just kind of wanted to go over all of that because I think it's really important. Like I said, wanted to record everything that happened to me, not because I had a good experience, not because I had a bad experience, but just my experience in general. And I think that not every person has a great one, and not every person has, or other people have a terrible one. There's gonna be ups and downs through healing, and this was one of my down ones. So I think if anything, happened for a reason, so maybe I can help others that maybe are going through the same thing. So if you have any questions, please feel free to private message me, okay? I hope that helps, ladies. Have a good night.